Good afternoon. Welcome to this training session for today. Seeing that we are a good number, we can start the session, but we encourage you to continuously just reach out to the teams and encourage them to join, share the link. My name is Miriam Mwangi. I work with Palladium. The reason why we're having this session today is so that for specific users who have not interacted with effectively adopt and implement this particular system, we need to take them through the system, especially the new changes, so that now they can be able to have a clear guide on the key system workflows that are required to manage patients in different service areas using TaifaCare Kenya EMR version 19.30 and above. So primarily, we had targeted users who are currently using version 19.2.2 and below, but even users who are also using version 19.30 and above are also welcome to joining in this particular training. So to start us off, I would like to hand it over to Tieno. Tieno, please.
Yeah, thank you, Marianne, and good afternoon, everyone. Marianne, confirm if I'm audible.
Yes, Tieno, proceed, you're audible.
Yeah, thank you. So I think just like Marianne has mentioned, first of all, I want to take this opportunity to welcome everyone to this training. It's going to be exciting for the people who are seeing this for the very first time. We consider to have this training so that all the facilities that have been using the system, maybe for HIV program, might also appreciate what has changed and learn how to navigate on the new interface. So a couple of things have changed in the system, as you'll be able to see. Basically, in terms of the overall navigation, so there are certain items that you have on your screen that may no longer be there in the new version. So take note of what has changed so that once your facilities are upgraded to this version, then you'll be able to navigate comfortably. So having said that, I want to just share my screen briefly so that we can go through what has changed. Marianne, confirm that my screen is visible.
Yeah, your screen is on. Proceed.
Yeah, I've also zoomed out on my pointer so that you can see where I'm pointing. I don't know, Marianne, if my pointer is visible.
It's visible, highlighted in green.
Thank you. Yes, so to begin, we'll just look at the overall items on the landing page. So after logging in this particular version, you are supposed to be directed to the landing page. So in the landing page is where I am. This is where we have a couple of dashboards. So the system is primarily designed for a facility-wide use case. That means all the service points in the facility are taken care of here. Yeah, the guys that can't see the screen, kindly just drop off and come back in so that you're able to see it. I think could be your network on your side. Yeah, so as I was saying, that the system is basically designed for the facility-wide use case. So we have a couple of metrics. We have a couple of metrics that gives information around the facility-wide functions. So, for instance, we have like top 10 diseases for under 5. So you'll be able to see that based on whatever those diseases are. Then we have top 10 diseases for over 5. We'll be able to see that. What are some of the top 10 diseases for over 5? And then we have the general OPD attendance for under 5. We have general OPD attendance for over 5. Number of emergency cases, number of referrals in and referrals out. And also we have a short graph just highlighting the progress in terms of patient admitted and the OPD visits. Yeah, so that is the dashboard, and you can filter using these dates, start date and end date. So you can go as back as you want, just to see maybe how those metrics are playing out within the selected time period. So that's it on the dashboard. Then if I focus our attention to the TaifaCare, to the green belt up here, we have the TaifaCare, which is the name of the system, but now this one is supported by Kenya EMR. So you'll find that through DHA, we have the digital health solution is called the TaifaCare, but then powered by different solutions. So we have TaifaCare powered by Tibabu, we have TaifaCare powered by AFKE, then we have TaifaCare powered by Kenya EMR. So this one is powered by Kenya EMR. So if you click on TaifaCare, that is supposed to bring you home. So whichever point you are in the navigation, if you click on this big TaifaCare name, it brings you back home. Then we have the facility that has logged in or that the system has been deployed to. So we have that. So much of the time you'll find that when you're logging in, it will be asking you to specify that facility. And then you can either choose to remember it and confirm, so that every time you log in, you don't have to specify the facility. So that gives you the facility where the system is deployed. Then we have the search patient function, which I think you all are having in your deployments. So we have search function. This search function works for local records or local patients. Local patient, we mean that the patient that are already stored in the local database. You'll realize as we start that right now there's a difference on how you onboard patients. In your case, in your facilities, most of you have been doing manual patient registration to add the patient, and then they record all these things. That has so far changed. Right now, the directive is that for any new patient, you have to search their details from the SHA information, from the patient identity management repository. So you'll find that you just have to use the patient ID, and then you pull the patient information. So that one you'll be shown when you start looking at the patient registration process. So that has really changed. So it is highly discouraged for you to use the manual registration of patients. Yeah, then we have the account. This one, I think nothing has changed. Then we have additional modules here that will explain. You have modules for bed management, lab manifest, supplies dispensing. We have stock management. This is a module that manages the facility inventory. We have the billing admin, where we can set different prices for different commodities and services. We have the dispensing application for the pharmacist to dispense drug. All these are available across different service points. Yeah. So then, when we look at now the menu on the left navigation side, where my mouse pointer is pointing, we have different sections. And if you look at what you have in the facility right now, you have so much more than this. So there was a directive to refine the menu so that the menu could reflect the actual typical patient workflow in a facility. That's why we start from registration. We go to triage, then consultation. If it is a mother, pregnant mother, we go to MCH. If it is an admission case, we go to admission. If it is a procedure case, we go to procedure. If there is imaging or radiology, things like that, we go to radiology. We go to laboratory for investigations. Then we go to pharmacy for dispensing. Then we have accounting for paying and managing bill processing. Then we have the reports. And then lastly, we have mortuary. So if you look at the workflow, it mimics typically how the patient flow would look like in a typical facility. So it is now much more simpler and easy to navigate as opposed to what you have in your facilities that has a lot of submenus under these items. So that is one major significant change that has been implemented in this particular version. Okay, so I wouldn't want to go through all this because we'll be touching on them briefly, but they are self-explanatory in terms of patient registration, triage, consultation, all the way to mortuary. Now, for facilities that will be using this system purely for HIV management, there's so much more that are here that you might not be able to use, but just be aware that the functionalities are existing. So it's just a matter of time before your facility goes facility-wide. So if a facility chooses to go facility-wide, then you need to be aware of these particular navigations. Okay. Yeah, so there are also a bit of changes when it comes to patient. So if I find maybe a patient, we can look at a patient profile. Yeah, so if you pick a patient profile, then you'll be able to see that this navigation menu for patient profile has also been summarized and refined. So right now we only have clinical encounter where you are able to see the encounters. You're able to see the encounter. You are able to see the patient history, patient examination, patient management, the lab results. All that is available in your current version. All these tabs that are here have been put under clinical encounter, so they are going down vertically. But right now we have refined them to now go horizontally, which is now easier to navigate for providers, and they're able to see where to get what very easily. So under the clinical encounter, again, we have the visits, where you're able to see all the visits and all the encounters, and you're also able to interact with the special clinics. The system now has all the special clinics. It's a whole list of special clinics here, all the way to urology, speech language therapy, everything. So you have all that under special clinics, and that I know applies most to the facilities that are implementing facility-wide. Then we have the lab orders for the patient. Here, the user will interact has ever been done for this particular patient up here. So this is Mary's profile. So you can interact with the Mary's orders, and we can see the status of each order, whether they were completed or not. And we are able to interact again with the results for every test that has ever been conducted for Mary. We have their laboratory result profile right here. If there have ever been any radiology x-rays done for the patient, we'll be able to see all that under the radiology section, and we'll be able to see their statuses and also interact with the results of those particular radiology orders. Then we have the procedure. Again, the same thing. We'll be having the orders here if there's any, and also we have the result here if there is any. For prescription, we'll be able to interact with all the prescriptions. So if there's any prescription that has been made, we'll be able to see it here. If there is any active medication that the patient is on, we'll be able to see it under the active medication. And historically, we'll be able to also interact with the historic medical past medications that have ever been provided to this particular patient. So that is available. And again, we have several options where you can reorder the same and also view what has been ordered previously. Okay, and I'll note this is also applicable to facilities that are using system for HIV management. It's very important that you are also able to interact with the prescription and also dispensing for those particular drugs. For the inpatient, also you'll be able to see what are the available forms for the inpatient. If at all this patient was admitted anywhere in the facility, we'll be able to interact with the inpatient forms. Then we have that dedicated section of HIV care and treatment, where we can record the defaulter tracing, we can document the defaulter tracing information. We can have HIV testing services, both testing and screening, all that will appear here. We'll be having the HIV patient summary that summarizes the information about how this patient has been receiving care, and this can also be printed out here and given to patients, especially when they're being transferred out. So that is very, very important. Then we also have the case management functionality that is still available. Meanwhile, I think the vital and anthropometric section remains the same as what you have. And also you'll find that there are now additional information around SHA and the SHA details that will appear up here. Okay, so that is much about the patient profile. Drug orders and lab orders still remains. If I pick, let's say I pick for that particular date, you'll find that you still have the drug orders, you still have the laboratory orders, the imaging orders, the procedure orders, and you can also order for medical supplies. So the orders remain in the order basket. Then we also have the clinical forms that you interact with. They are all available here. Like if you want the green card, you'll find the green card is still available somewhere, especially for HIV patient. You'll see that we still have the green card and all the forms that pertains to HIV management and also for general patient management. So that still remain. And lastly, we still have the visit notes, especially for additional notes that maybe the provider would want to add to this particular patient. So all in all, that is a summary of the navigation of the new version of TaifaCare powered by Kenya EMR. So at this point, I think I'll just end it at that and hand it over so that we can now do the actual patient walkthrough. I think we'll be mimicking a workflow of an HIV patient right from the time they come in all the way to what you need to do. So I just want to hand it back over to Miriam to guide us on the next presenter. Over.
Thank you, Otieno. And we will start off from where you have left, looking at the patient workflow, starting from the first point where we get our patients. So for this particular session, we are going to look at onboarding a patient. So what do we need to do here? One, we need to look at how we assess specific access the EMR for a specific user, and how to onboard clients in TaifaCare Kenya EMR, how to start a patient visit, and how to access patients from a queue so that we can now provide them with care. So to do this, allow me to share my screen. Kindly confirm my screen is visible on your end. Otieno, confirm my screen is visible for me to proceed.
It is visible, Miriam. Please proceed.
All right, thank you. So as we seek to answer the four questions, one, how a user will access the EMR systems. Two, how we are going to onboard clients. Three, how we are going to start a patient visit. And four, how we are going now to access a patient from a particular queue to offer them services. I will log in, and for us to be able to perform tasks that will help us to answer these questions, it means we will involve different users who may have same or different responsibilities depending on how a facility is set up. So my first user will be at the registration desk or at the first point of contact when a patient comes into a facility. It can be the registration desk, or it can be the reception or the inquiries desk, depending on how a facility is set up and what level of a facility it is. So whose main role now is going to onboard a patient into the system and queue them for the first service. So I'm going to log in as a registration clerk. So when a user logs in, they will encounter the welcome page or the welcome page, so that one, they can be able to confirm where exactly within the system they will be logging into, depending on the responsibilities they have in the system. So our user, who is a registration clerk, will be most useful, most probably maybe at the OPD. So that means we need to log into the facility location. So we will select the applicable location and confirm login. Now, if a user will be logging into this particular location all the time, maybe they do not need to access other locations, then they can be able to check, remember my location for future logs in. And then the next time they log in, or in the future when they log in, the system is going to bypass this welcome page and it will take them straight to the landing page. So once I confirm, the system now will redirect my registration clerk or user in the system to this particular page where we've logged in as a receptionist. So within the improved role-based access within this system, a user will only access modules and information as per the roles that we have given them, or as per the roles given by their system administrator, which now will align with the responsibilities they have within the facility and also what they need to do in the system. So for the registration clerk, they will only be able to access the registration module. That is why you're seeing the only module they can be able to access is the registration module. And they will also be able to access other modules, and we'll be able to see which ones. So to explain this window, one, they will be able to see the location where they have logged in. Currently, when we were at the landing page, we selected our location to be the facility. For this test instance, we have Marindi Sub-County Hospital. If they may need to change from this particular location to another one, clicking on this itself is a link, will take them back to the landing page and they can be able to choose another location. Now, this is applicable to users who may need or interact with different locations, or they have responsibilities that are cutting across different locations. But for our user, her functionality or their functionality is at the outpatient within the facility setup. Then they will also be able to access some icons, what they will be able to see within the landing page. One, they will be able to see their names, the registration name. Then again, they will also be able to see the validity, license validity. Now, this is pulled from the healthcare worker registry. This is information that is coming from various professional bodies a user is registered and regulated by. And a facility will be able to pull healthcare worker information from various professional bodies where the staff are registered, such as from the Clinic Officers Union, Pharmacy and Poisons Board, Nursing Council, KMPDC, and Kenya Medical Lab Technologists and Technology Boards. Then again, for now, those are the available boards that we have. Other professional bodies will be added to allow all healthcare worker verification. So if a user who is logged into the system has been verified through this process, then their license will be seen as valid. If they have not been verified from the healthcare worker registry, then their license will be seen as unlicensed. And we'll be able to see how that is going to be set up within the facility so that we can also be able to validate all our healthcare workers. Then the user will also be able to access some icons. One is the search icon, the magnifier search icon, to support them to look up clients and patients existing within the facility database. They will also be able to access the icon for my account that will be able to allow a user to either change their password over time if it has been compromised or they feel that they should change depending on the facility rules or the county rules. Maybe a password should be changed after every 30 days, after every 45 days, and so on. Then again, from the same icon, they will be able to access the functionality for logging out when they're not using the system, or when maybe they are logging out or clocking out during the end of the day when their shift is done. At the same time, they will also be able to access specific modules that are again in line with the roles and responsibilities they have in the system. For example, for my user who is a registration clerk, the only thing, any other important module they'll be able to see is the appointments module, where maybe they have been tasked to schedule appointments for patients. And we'll be able to see this, how these models with different users. Then at the same time, the middle part now, this is the part of the window within the registration module that now will provide the workflow that the user needs to perform, aligning with their duties. So with this, we will be able to answer the question, the first question, that is how to onboard clients in TaifaCare Kenya EMR. For this particular user to be able to perform this task, it will be dependent on the client or the patient and the current guidelines of using a client identifier to verify a client. So we will use two scenarios to demonstrate this. One will be the scenario of a client who comes in who may be unresponsive, either they are comatose, unconscious, or it's an emergency case where we cannot be able to really ascertain the patient details so that we can be able to get an identifier from them and be able to use that particular identifier to verify the client from the client registry. So that means when we're verifying clients from the client registry, we will need a specific identifier. And these identifiers can be, one, for an adult, we can use a national ID or we can use a passport. Two, we can use the birth certificate number for a child. Three, we can use an alien ID or a refugee ID for a person who is a non-citizen within the country. So in case this particular scenario where we are looking at a patient who is coming in, they do not have any of these identifiers. They do not have a national ID or a passport. If it's an adult, they do not have an alien or refugee ID. Then again, if it's a child, they do not have a birth certificate number or the patient is unresponsive. So for this scenario, the system provides for an emergency registration option that helps bypass the client verification process. So by clicking on the emergency registration button within the system where my cursor is, it helps us now to load the registration form. Allow me to increase the view. And this is the same registration form that we were using previously, where we will be expected to fill the form in its entirety because we cannot be able to get some of this information from the client registry. So starting with basic information, we will look at the patient name. For example, we can call them tests, registration today. Then we also expected to fill the sex. We can say they are male. Then we can also have the date of birth. If it is known, if we don't know the date of birth, the patient can't remember the date, the month and the year when they were born, then we can use the age by selecting no, estimate, giving the system an estimate of the age. Maybe they can stay there around 59 years, 3 months. But if it's a patient who actually knows their date of birth, then we can use the date picker within the system to be able to give the exact date of birth. So we can maybe say our patient was born in 1975 within the month of February 15, and the system will give us that particular date. Then from this particular section, we'll also be expected to fill any available IDs or generated numbers that are unique to a patient, that a patient is willing to provide. Some of them may be national numbers, others may be just generated within the facility. Of interest to note is that this particular section, all these particular numbers and IDs are optional, but we can fill them if we have and the patient is willing to give you. The second section is where we are filling the contact details, looking at the location, the phone number, the email, contact details of our patient, so that we can ascertain from which region or where our patient is coming from. So for example, a patient may be coming from a particular county. We need to fill the county, sub-county, and ward information. The system offers the option of searching using the lower level, we can use a word to search. For example, I'll use township, and I can select a patient maybe is coming from Laikipia, Lumuruti Township. And the system now will auto-pick the county, the sub-county, and the exact word. Then we can fill now the phone numbers that a patient is going to give you. It is highly encouraged to elicit this information, but again, if the client does not have or they're not willing to, the information is optional. Either they have a phone number or an alternate phone number, a postal address, an email address, where exactly are they coming from, down to the location level, the sub-location, village, landmark, and the nearest health center. That is optional, but it is also very important when trying to trace a patient in some of the programs we have. Then when we go to the demographic section, to notice that this particular section is not optional. That means we need to fill all the fields for this particular section. So I'll quickly fill for our dummy patient, married monogamous for the marital status, maybe they're a trader, the education level is a secondary education, religion, they may be a Muslim. Then does the client have any disability? We can say yes, and if you say yes, the form will expect you to give the exact disability that the patient have. So this is one of the additions that you may not have in the current version that you have currently. So we can select maybe our patient is visually impaired. Then we can proceed to fill the next information. For death information section, this is only applicable to document if the client dies before or during the time we're offering them care, where we'll be expected to check if the patient is dead. And when we check that, we'll be expected to fill the date of death and the time they died and the cause or the exact reason as to why the patient died. For this particular user, we will not check that. Then the relationship section, again, it is still the same. It allows additions of several associations that a client may have existing within the database. For example, we can have associations of existing users who are already clients, or even users who are providers within the system, where we can be able to add a relationship for family members, a mother and children, a mother and a husband and a wife, spouse, case managers, or a physician who is a family doctor, something of the sort, and we can be able to add relationships. So clicking on add relationship will give you the option of searching for the person you want to create a relationship with to our client. Then define the relationship. Is it a doctor, a user within the system? Is it a client also? And what is the particular relationship for that? Then also the last section, we're expected to fill the next of kin details. This is to provide information for a person who can be contacted on behalf of the client by the clinical team to either sponsor, support, or locate the client. Again, these are optional fields. So what I've done is just fill the mandatory fields so that we can be able to quickly proceed. Then when you're done with your form, remember, it's always encouraged when you're meeting the patient for the first time to fill as much information as possible, because most of this information is also used elsewhere, and we'll be able to see how some of the mandatory fields coming in even from the registration form are used to inform specific decisions, alerts within the system, and even some machine learning models that we have. So when we're done with filling the form, we will register our client by clicking the register button, and the system will let us know that the new patient has been created. So that is one way of onboarding our patient within the system. That is in cases where they cannot be able to produce an identification type that can be used to validate them from the client registry. So the next, the second option, which is now the recommended option that we will be working with moving forward, there may be some changes to this, but as at now, we will look at this scenario where we have a client who is responsive. Either they have come as a self, or they have come with a dependent, or they have come with somebody else. And the most important thing is that they can be able to avail a required identifier. Again, we're looking at the identifier, as we had said, for an adult, for a child, and even for somebody who is a non-citizen. So we're going to assume our client is coming today. They can be able to provide a national ID if they are adults. And this particular section, we are going to use the national ID number to be able to query from the client registry, accessing it through the Health Information Exchange to provide client details. So when we try to do that, that means we need to input a number for our patient. Two things can happen when we put the ID number. For example, let me just try to use a dummy ID number. Try to get an extra number in so that we don't get a patient. When I do that and try to search, you'll find that the system is taking a few seconds to search. What it is doing at that time, it is querying the client registry through the HIA layer. And for this particular ID number that I've input, it has tried searching and it has not found a patient. So that is one of the outcomes you can get. One is you cannot be able to get this particular number. So for this, it is advisable to get the actual document from the client instead of hearing it, them just telling you the number. For example, you're asking for the ID and then they're just giving you the ID number. To avoid either one, querying the wrong person, or two, not getting even the correct person, either they're not giving you the correct information, it's always good to ask for the physical identifier that they have come with, either the physical national ID, a physical passport, a physical birth certificate, and so on, so that you can be able to capture the correct ID number. So for this section, we will need to use an actual ID number. And for the ID number that I'm using, the user has given full consent to be able to use their ID number. Then we can search for the patient. So this particular button helps us to search or query the client registry using this national ID number. And when we do that, it takes around 5 seconds. It gives us a probable patient or the patient whose details are attached to this ID number within the client registry. So for this to happen, a facility needs to be integrated to the HIA layer. And once a site is synchronized with the HIA layer, they will be able to pull some specific system information. We'll be able to show this during the administrative section that we have tomorrow. This is a task that the facilities may not be able to do on their own. You will need to contact our service desk team or contact the partners on the ground, the EMR TOTs, or the county ICT teams to be able to help us to integrate a facility with the HIA layer, so that when now we input particular identifiers for our clients, we will be able to query directly to the client registry, and the client registry will be able now to give us feedback, so that now we can pull that client information directly into our database without us having to manually enter the registration form. So for the patient that I'm using, we will be able to see some specific details or access some details about this particular client. We'll be able to see their gender. We can be able to tell their date of birth and the age, and we can also be able to see the client CR number. And as well, we can also be able to see what they're eligible for as per the UHC in terms of what programs are they eligible for universal health care. Is it SHIF, is it PNC? We'll be able to see all that, and we can be able to tell that a patient is eligible. If they're eligible and they are actually active in this particular UHC, then we can even be able to tell active to what point and what category of client do they have. Are they the primary caregiver? Are they the primary person? And so on. Then for the system now, for us to be able to get consent from this particular client, whose details now we want to see. Remember, even the name, we can't be able to tell the name correctly because it has been hashed. So we need to send an OTP to the client by clicking on the OTP button, send OTP button. And once a user agrees for us to access the information, sending an OTP now is like requesting them to give us consent to be able to access their OTP. So before sending the OTP, one, we need to verify where this OTP will be sent to the client. So that means there has to be a phone number that is attached to this particular client for them to receive this OTP. And this client phone number is actually pulled from the time they were registering to SHA for them And this is actually the number that is attached to this particular client. To be able to verify this, we're going to use the icon change phone number that has a pen. By clicking on it, we can be able to access the full number, ask the client to read back to you if this is the number they used to register with, and this is the number that we are going to send them an OTP. Then also confirm with the user whether they actually have this particular SIM card within their phone number. If they can't access the phone number or they replaced it with another line, the thing here is to request them to have the number updated either from Afya Yangu mobile application or from the SHA portal. For now, we can't be able to edit this phone number within the system and send the OTP. But if they update the information from Afya Yangu or the SHA portal, then we'll be able now to get the correct, most valid number that we can be able to contact our patient with or our client with, and we can be able to send that OTP. So if they confirm this is the number and they have the device to access the messages that we are going to send for them to see the OTP, then we can click on send OTP code. And as we do that, we will have the message sent to their phone, ask them to check from among the messages from their phone. So this particular message will be sent by the facility where a patient has come to access care, and it will read like follows. Hello, specific client, Marindi Sub-County Hospital wants to access your clinical records for claims processing, and we can use the code that has been given there. Again, the system will be able to alert you that this particular code is only valid for 1 minute, and you can be able even to tell by the counter. If the counter lapses to 0 before you can be able to verify, then the system will give you a warning, an alert message telling you that particular OTP cannot be verified and you need to resend. So instead of verify, we are going to have a resend button here. So in my case, because of time, I'm going to verify. So unfortunately, it's like the OTP expired. So once it expires, it is going to give you the message or the warning that I had just said. So, and then it's going to ask you to request for a new one. So we're going to do that again, send OTP. So sending OTP to a client phones takes less than 8 seconds or less than 10 seconds. Again, this also depends with the connection within the facility. For this to happen, this particular user or machine that is accessing this needs to be on internet. So once we verify, the system now will allow us to access this particular, some particular information about our patient and allow us to do several things. One of the things is that we'll be able to check in our patient, and we can also be able to see dependents that are connected to our patient, who is the primary scheme holder. So when I select on show dependents, it will allow me to see all the dependents that have been added to the scheme for this particular user. So we'll be able to see children and spouses. And for this particular part, dependents can be accessed from the primary caregiver, yes, and you can even be able to initiate a visit by checking them in directly, because consent will be given by the person who brought the kids, who is mostly will be the primary scheme holder. But if our user is the spouse who is above 18 years, then the system will also expect that you will need to get consent from them to access the information by sending an OTP and now allowing you to check in the spouse. So if the user who is coming in to be seen to the facility is not a dependent, it's the self or the primary scheme holder, then we can proceed to check them in, and that now answers the question on how to onboard a patient. So one is through the emergency registration for cases where we cannot be able to get an identifier type to verify our patient. And two is through the verification process, where we are pulling information from the client registry through the HIE layer. And for that to happen, we'll need to have configured our facility to do that. So we'll move on to the second question, which was how to start a patient visit. So how we start a patient visit is by clicking on the check-in form. So when we click this, The system will help us to check in our patient by providing a form, the check-in client form. And from this form, we'll be able to perform several things. One, we can be able to see the type of visit. Currently, it's a new visit. There's also the option of checking in a patient for an ongoing visit. If something they had been checked in earlier, then they had to go to do something and you come and search for them again, you can still continue with that visit, selecting the ongoing part. Then you can also be able to check in a patient in the past. This is in cases where we are doing retrospective entries and we need to capture specific information that happened for a particular period of time. The other thing is that we'll also be able to access patient upcoming appointments. This is applicable if this particular patient had previously come to this facility and we had issued appointments, we will be able now to see or access upcoming scheduled appointments. For our case, where there are no upcoming appointments because our patient is new, totally new in this particular facility. Then we'll also be able to get the visit location. Where are we checking in our patient within the facility? So again, we can be able to tell we are checking them in at the location that our user has logged in, which was within the locality of the OPD that is within the facility. That's why we are seeing the visit location as Marindi Sub-County. Then we'll be able now to ask our patients some questions so that we can determine what is the purpose of their visit today. One is by asking what services do they require from us today, and from what they will tell us, we'll be able to know whether our patient is coming to the outpatient department, the inpatient department, whether it's a body that is coming to the morgue, or it's a casualty emergency case in cases of patients who are unresponsive, accident or emergency cases. So for our patient, we will select outpatient. Again, we have the search functionality. This is to be used for high volume sites where we may have a lot of locations within the facility where we can be able to check in patients. So if the facility has a lot of them and they may crowd this section, there's a provision of searching for a particular department and checking in our patient to that particular department. Then the next section is that we will be able now to look at our patient in terms of what category are they, how can we be able to term our patients. So the provider will ask the patient for the purpose of the visit or the need for the visit today. And from there, we can be able to tell whether they are coming for clinical services so that we will categorize them as a triage patient, so that the expectation here is that we're going to start the clinical workflow as defined by a particular facility. For some facilities, the clinical workflow starts at the triage. For some facilities, it may start at the clinical room, again, depending on the volume of the facility and the roles and responsibilities of the different users. If the patient is coming for specific services, such as maybe they're just coming in for a lab test, they're just coming in for an imaging service, maybe they're just coming in to pick drugs, coming for a drug refill, then we are going to term our patients as a walk-in patient because they may not really go through the entire clinical workflow. So we can either categorize our patient as a triage patient, clinical services being accessed, or we can be able to classify them as a walk-in patient if they're coming for specific services. Then once we determine what our patient has come for or the need for the visit, then we need to determine as the user who is checking the patient, the first service they need to go to so that we can be able to send them to that particular room. So for example, if our patient is coming for clinical services, then we can be able to send them to either the triage rooms that we have in our facility, the OPD rooms or clinical rooms, screening rooms, casualty emergency rooms. But if our patient is coming as a walk-in patient who is coming for a specific service, then we can be able to just check them in and send them to that particular room where they're accessing the service. If they're just coming to pick drugs at the MCH, then we can send them to the MCH pharmacy as the first room where they need to access a service. If they're coming in just for a lab test, then again we can send them or check them into the laboratory room as a walk-in, and so on. So for our patient, we're going to say they're coming for clinical services, and we're going to select the first room where we need to send them to. We can say we are sending them to triage room 1 within the OPD. Then once we have determined the first what our patient is coming to the facility to do and the first service that we need to offer them and where we need to send them. We also need to establish the mode of payment a user will prefer to use. And this is so that you can be able to know during the course of offering them services, giving them maybe specific commodities that are required, how will they be able to settle the bills for some of these services and commodities if there are charges that are applicable to these particular services and commodities. So we will ask our patient questions. One, we need to determine if they are exempted from payment. And if they're exempted from payment, again, the exemption criteria in our facility may differ. We will say yes, they're exempted from payment, and we will proceed to define what exemption category are they. So, for example, the system provides they can either be in prison under fine, a CCC client, refugee above 60 years, some of the patient categories where we don't expect them to pay, but again, this differs per facility. It is configurable, so we can be able to reach out to our service desk team and to partners who are supporting so that we can see how we can be able to define the exact exemption criteria within our facility, either by patient category or even by service or commodity being offered. So if our patient is not exempted from making a payment and we expect that they will service the bills arising or carrying during the period we're offering them care, then we're going to select no. And now we're going to determine the exact payment methods by asking them now, Uta, how will you settle the bills that will occur? Again, these are configurable depending on the payment methods that we accept in our facility. We can be accepting cash payments, mobile money, cashless payments. For example, mobile money and insurance. For our case, we're going to select insurance. Then when you select insurance, the system would want to know which exact insurance scheme is our user using. Are they under the universal health care coverage where we can have the SHIF scheme, under the SHIF scheme that is implemented through SHA? Or do they have a specific particular insurance scheme? Then we can be able to select the most applicable one. Again, this section is configurable. We can be able to configure the insurance schemes as to what we have permitted within our facility, and our team is available to help and support to do this. For this section, I'm going to select SHA. Then when I do that now, the system now will pick the policy number for this particular user because we had pulled the details from the client registry from the HIA layer. We can be able to tell that our patient is active for PHC under the SHIF scheme, and they have an active, they're actually active within this particular scheme. So when it comes to SHA, we will be able to choose a package from which our patient will be seen. For example, I can choose the outpatient services package. Then under this, we will be able to even select the exact chargeable service. Sorry, chargeable service within the outpatient package that we have chosen. And maybe for this particular facility, we do charge for clinical consultation as the first service that our patient will be offered. So that means we have been able to fully fill for our patient, one, confirming the visit type, the department our patient will be seen, the patient category where we have sent them to access the first service, if they are a paying client or an unpaying client. Then again, if they're a paying client, the method that they were used to pay, down to even the looking at the particular method, what if it is insurance, the scheme, again, if the scheme is active, even choose there among the recommended packages, for example, for SHA, and even define the first chargeable service that our patient will access within this particular package. And we can now be able to comfortably start a visit. So when you do that, again, the system will be able to do three things for us. One, it will start an active visit for the client. it will queue the client to the first service where we have sent them to the triage or the OPD, and it will also create a bill for the first chargeable service that we have selected. And we can be able to see all the 3 successful messages showing that within the system. If you get an error for any one of, if you get an error while filling the the start visit form or the check-in form, again, we should be able to contact either the EMR, TOT, or the partner who is supporting you, or our service desk team, just to check on the error and see whether there's something wrong with the modules. Again, you can also cross-check the form if there's something that you have not filled correctly. So the system is supposed to auto-refresh. When I auto-refresh that, it means my client has been created within the system. So the essence of checking in does 2 things. One, it will allow us to be able to fill all the information that you have just filled, confirming the visit type, the client, how they will pay, and where we are sending them first. And 2, it will also now create that patient within the facility for us by giving us the exact registration form as we had assessed when we were doing an emergency registration. So we will proceed to the final question where we have to answer how to access clients from the queue. So allow me to log in as a different user, because when we're accessing clients from the queue, from the queue, it means we have to specifically get into that particular queue as a different user to be able to see clients who have been sent to our service area or to our room. So for this particular session, I'm going to log in as a triage nurse, see whether within the queue that I have, whether I'll be able to access the patient who has been queued for OPD triage. Again, when they log in, they will be requested to state or select where, from which location this particular user is logging into. And the system will direct them to the specific area of interest that is within the triage. We can be able to see the user who has logged in is a nurse, a triage nurse. And again, we've not validated them or verified them. So the license is unlicensed. If we have validated them, that is, we can be able to access the specific policy body number from the particular professional body that they belong to. That would be the nursing council. Then we'll be able to see if they exist within the nursing council, they have been licensed to practice, and the license will change to valid. So when we access the triage modules, we can be able to see specific things from here. So the system will redirect us, redirect a user to this particular page where they will be able to access the queue per room. So again, depending on this triage section in a facility, the different rooms where we have for triaging our patient, we will be able to see all of them here. Again, this is configurable in a facility, and we can be able to assist to configure. And this is triage specifically for the outpatient department. So we can be able to see the different rooms within this particular module. Then we can see the queue room statistics. For example, if I select triage room 1, where we had placed our patient, we will be able to see some statistics on top here. We can be able to tell that we have 1 client who is waiting for a service. We don't have anybody who is being attended to currently, so we have 0. Then when we access the other rooms, again, we'll also be able to see if there are patients who have been queued to their specific room. So a user will only be interested in the room they are in so that they can be able to access their queue. Then we'll be able now to see the patient who have been queued to the specific room, and we'll be able to tell some details. We can access their name, the queue number, the status. Currently, they're waiting at OPD, and even the waiting time. For how long has this particular patient been waiting in our queue? So the queue is ordered by the check-in form on a first saved basis, and the nurse provider can now be able to offer the service that the client had come in for. That would be within this particular section, offering, my system to just refresh, offering the triage services where vitals for a patient will be taken. So against the name of our clients, at the very end, we have a section where we have the 3 dots. There's the option of calling our patient. And this particular button also, or this particular button and functionality serves 2 things. One, when I click on call, we can be able to access the queue screen for this particular facility. Allow me to just go direct to the queue screen for the same facility so that you can see how that happens. Give it a few minutes. I want it to refresh quickly, so just allow me to log in. So I'm just logging in as a different user so I can be able to quickly access the queue screen. So within the Kenya EMR modules, we have the section for queue screen. And we can be able to access these particular facilities. So as the user who is at the OPD room 1 is calling our patients at the waiting area where the clients are seated, if we have a screen, the provision of a screen and some speakers, this is what the patient will be seeing. They will be hearing their ticket number being called out to enter the room. And our patient, once they come into the room, our user now, the client, the triage nurse will be able to confirm and verify this is our patient. If they call them and they're not able to get them, then there's the option of requeuing them to the queue so that they can serve the next available person, but they can as well just go ahead and serve and perform now the actual functionality as to what had brought the client into their room. So this is what a user now will be able to access for our clients. They will be able to access the full names of our clients. They will be able to access the insurance scheme that our client is using to pay for, the policy number. They will also be able to tell where our client is within the facility. They are currently in OPD triage room 1, and we have an active visit. Again, details about the patient, the age, the date of birth, and the client number, the client registration number. Then once they are done in providing the service within this particular section or room, that would be now to record vitals, and the triage form will pop up. They will now be able to also queue our patient for the next service. So it becomes like a train, sort of, where one user will transition the patient to the next user. So if they are done with recording vitals to our patient, they will be able to assign them to the next queue, maybe now for clinical services. Now, when they do that, this is the form that they will be able to access. Select the exact service location within a facility as has been configured. Maybe after triage, they will go to the clinical consultation room at the outpatient. And we can even be able to define, even at outpatient department for clinical consultation, if we have several rooms, which exact room are we transitioning our patient to? For example, we are transitioning them to OPD room 1. Again, they will be able to assess the priority level of our patient when they're doing or recording the vitals, whether our patient is an emergency case, urgent or not urgent, and that will also be automatically done by the triage forms using tools. If there are any comments, they can be able to comment, and they will be able now to assign our patient to the next queue. So allow me to stop here, because we've been, the task for today was to help us to answer those 4 questions around how we can be able to onboard our patients, focusing on functionalities that are done at the registration desk or at the reception. And we have managed to do that. And we can pick up from there tomorrow, where now we are going to look at the clinical workflow for patients in various clinical services. So I'll hand over the mic to Otieno to support in the next section for Q&A. Allow me to stop sharing. I'm not sure if Otieno is still on call, but we can have questions. For this particular section, we did not want to have an overload of information, so that it can just be like an introduction to the new features that we have within TaifaCare Kenya EMR. So we can open it up to questions. You can utilize the chat area, the Q&A area. Our team on call will support to answer the questions. But if you feel you want to voice your question, you can raise your hand. Already I can see we have 2 hands on call. We can start with Alice, then go to James. Alice, you can unmute. Alice, if you are speaking, we can't hear you. On my end, it seems like you're still muted. Kindly unmute. Then we can voice.
Thank you very much, Mary, thank you very much for a nice presentation. I'm Alice from Osigo Sub-County Hospital. So my concern was about issue concerning registration. Suppose I have a client, an adult, conscious one, but doesn't have ID nor birth certificate. How will I go about registering this client in the system? Thank you.
Thank you, Alice. We can take another question. James, and then Wood. You can start with James. James, you can unmute.
Hello, good afternoon.
Good afternoon.
Thank
Proceed.
you for the good presentation. I think it is a very nice introduction to the basics of the Kenya EMR. Just my concern, although my concern might be, I might cause it prematurely, but it's good we have it learned about the kids and involved in the delivery. Thank you.
James, I'm sorry. I don't know whether it's the connection on my end, but I couldn't hear you. There was some static. Maybe you can try again or raise the question on the chat, and then we can respond. Then we had Wood. You can
Yes,
unmute.
I've raised the question on the chat.
Oh yeah, actually just continue, because now we can hear you clearly.
Yeah, you've heard me.
Yes,
Thank you.
yes, please.
My concern is that this is a new model and a new fashion, of course. I believe what taken us through is very detailed and elaborate for us to be able to understand. Thank you for that presentation so far. So my request and concern is that is theater empaneled in that anesthesia chart, so that everything is done electronically, so that whatever you've done to the patient is tallied in the system. Thank you.
Okay, we can take another question from Kalama Sandosi. If you can unmute from your end.
Okay, my name is Kalama from Kodiaga Prison Health Center. Thank you for the nice presentation. Yeah, my question was about the registration part. Here comes some time, because at Kodiaga we are using this version, and here comes some time. You see a client is registered in SHA. He has even been claimed in the SHA part, but when you want to register the client, when you validate the ID, so that you can fetch the client's information from the client registry, you find that the client, you can find the client, but you can't send the OTP to the client. The client can't get the OTP, and the number that is registered in the SHA is the same number that is it is in the registry. Thank you.
Okay, thank you for that. And then you can have Kahawa. Then we can purpose to answer those questions first. Kahawa, this is Kahawa level 2 hospital. If you can unmute, kindly proceed to ask the question. If you're not able to, you can raise your question on chat. We can have Mcharo.
Yes, good afternoon.
Good afternoon. Proceed.
Thank you for the wonderful presentation. This is indeed a very good system. So I am Amos from TaifaCare, Moivoi County Referral Hospital. My question is about on the lab integration. Because previously, as our facility, we are planning to use the Kenya EMR as our main EMR method. So the problem was the lab integration, because currently the lab has a LIMS system. Is it possible for the system to be integrated so that we can avoid that manual filling of parameters, that is compound parameters? Thank you.
Thank you for that, Kahawa, level 2 hospital. We will be able to answer. Then we can take the last one from Lois Motuko. Lois, if you can be able to unmute from your end. If you cannot, then we can just voice the question on the chat area. Lawrence, if you can proceed. Lawrence, yes, continue. You can unmute and voice your question. Again, if you're not able to unmute, just voice on the chat and we can respond to these particular questions first. So I will respond to some, then I will invite my colleagues on call, Moses, to respond to the rest of the questions. So starting with the registration question, if a client is an adult, they do not come with any ID identifier, they've not even registered to SHA, we cannot be able to have any identifier to validate them or verify them through the client registry. Then we use option 1. Remember, when we were going through the presentation, we had two scenarios. So this is applicable to scenario one, where we had a patient who is coming in, either they are unresponsive, they are comatose, maybe they are unconscious, or it's an emergency case and you need to give them immediate care. Or the patient is there, yes, they are okay, but they tell you they do not have an ID, or they're not even willing to give you an ID. So that means you need to let the patient know that for that reason, they may not be able to use SHA to make payments or to make claims, and they may be obliged to make other payments through other methods if they have another insurance, or they can choose to pay via cash, either physical cash or using mobile money. So when that happens, the system still has an option of us registering that patient, but now we will register them using the link of emergency registration. So this link allows us to be able to register our patient. It will just load for you the registration form like we had previously, and we will continue to register our patient. I need to log in. I've been logged out. We will continue to register our patient using the registration form. Just log in as an admin. So from the registration module, this is the link for emergency registration. I know the system still has the provision of adding a patient using the old icon of that will still give you the same form, but this feature may not be available in upcoming versions. So we really encourage the users to either use the emergency registration section to load a registration form in case where we cannot be able to get an identifier type to verify our patient with. And then again, if our patient is applicable to scenario 2, we go ahead and verify them using the identifier type that they will provide, depending on the patient, as an adult, a child, or a non-citizen. The next question that had been asked was whether this particular system we can be able to document the anesthesia part. So this system, as we will see in consecutive trainings, has the provision of documenting special clinics, where we have workflows integrated for around 23 or 24 special clinics that are available in a facility, surgical clinic being one of them. And the workflow for surgical clinics allows you to also document the section for anesthesia, and you can be able to review and go through this particular section. Same case from inpatient, the same can also be accessed. What we encourage is for you to go through that particular section from our test instances or our training instances. You can be able to review the workflow, and if there's anything that is missing, then you can be able to give it to us as an enhancement request. Then for the request from Kahawa Level 2 Hospital on LIMS integration, we are currently able to integrate Kenya EMR with LIMS so that we can have a seamless conversation within the system. When a clinician makes a lab order, the system is going to transmit that lab order directly to LIMS so that the lab team can be able to visualize the order. Once they process the order, they finish with their workflow and give results, the system will just be able, LIMS will be able to post results to Kenya EMR, and the clinician will be able to access that. So this is something that has been done currently in use in some facilities. So what we need is to just get in touch with our team, either the HIS personnel supporting you, or through the partner, or through our service desk team, and we can be able to see how we can support Kahawa Level 2 Hospital. Before we go to the next round of questions, I can still see Mcharo hand is up. Lois, your hand is still up. If you can be able to voice your questions, or just put in the chat area. Lois, as I welcome my colleague Moses to pick up any question I may have forgotten.
Well, Marianne, thank you, but I wasn't taking note of the questions. Will you please let me know what the questions that you want me to tackle?
There was a question on a patient is registered to SHA, but they cannot be able to get an OTP. Maybe you can speak on that.
Yeah. Thank you. Yeah, actually, we've come across scenarios where some certain patients who we are not able to receive the OTPs back. And what we've learned over time is it is stemming from either two things. One, for patients who have blocked any promotional messages in their phones, they will not be able to receive the OTPs back from SHA. So that has been noted, and the way to unblock that is there's usually a shortcode that I'm sure you can just Google about that on how to unblock a promotional, how to enable promotional messages from either Safaricom or Airtel line. Most of the time that has been the issue. So the moment you come across such a patient, please ask them to just enable promotional messages so that they can receive even messages from SHA. The other thing we also noted a while back was there were some feature phones that were not relaying back the messages, but it's something that I think that the team is still working on unraveling, especially those two Kabambes and those feature phones that you all know about. They're not, so by feature phones, I mean those that are not smart. So it's something that we also noticed for some, not all. I think that answers that, Miriam.
Yeah, thank you, Moses. So the person who had asked that question, you may want to confirm with the user the gadget they're using, and also whether they have also blocked USSD messaging from their phone or promotional messages. The people block promotional messages, so it also becomes a problem. You may want to unblock them first before you send the OTP. But I also encourage the users to use smartphones. They work better. So before we go to the next round of questions, we can just quickly go through the chat area and just look at a few questions. We still have time. We're still within time. So how to do? Yes.
Yes. So a clarification. That question was from Onlim. It was from Taita Taveta. That is Moi Voi County Referral Hospital, not Kahawa.
Thank you for the clarification.
Thank you for that. Yeah. Thank you for that. So we can quickly just sample a few questions from the chat area. How to document transfers and re-enrollments. Clients who enrolled in your facility transferred out but has returned once more as a transferring the new version of the EMR. Tomorrow we're also having another session where we'll now look at the clinical workflow within the system, where we're going to look at how to onboard a patient to a particular program, how to access their forms, and so on for the different patients that you may have. Whether it's a patient who's just coming for outpatient services, for special clinic services like at the CCC, at the OPC, COPC, DOPC, and so on. Again, whether it's a mother who is coming for mother-child services, whether it's a child, and so on. Whether it's an inpatient client, whether it's a body that we are registering to the morgue, and so on. So allow us to not jump the gun on this one, but tune in tomorrow and we'll be able to see how this happens. The other thing you may also need to check, if you're on the new version of EMR, confirm which date of the EMR version you have. We have had two versions of 1932 within the last 2 weeks. So you would want to be on the most latest version, because I know there was a problem here with this particular form for enrolling HIV clients, but it was resolved. So kindly reach out to our service desk team or the partner who is supporting you on the ground, and they will be able to resolve this. And as again, for the program enrollment, let us check on this tomorrow. Same case with Beta Sub-County Hospital. The reason why I picked that question is because I've seen it repeated. Then are there specific configs that needs to be done to the server to be able to query from the patient registry? Asking because I'm running this version, yet when I put my ID number, I cannot find client details. Yes, there are specific configuration when I was searching my particular ID from client registry, as I said, for the system to be able to query the client registry through the HIE layer, you need to have some specific configuration within a facility. So this will be again showcased tomorrow, but I can quickly highlight on this so that we understand. So when we are choosing this, selecting an ID to query, and when we actually search, be able to pull an output from the client registry, it means our facility from Kenya EMR modules, if we access the facility details, have been configured in a way that they're able to pull this information that is required. Sorry for that. We can be able to synchronize with the HIE layer, but for us to be able to do this, there is a particular configuration setting we need to do within the database, and this is technical. So the technical team who supports you within your facility, either the system admin, the ICT officers, or the EMR champions, know how to do this. And you can also reach out to us to assist you. Actually, you need to reach out to our help desk team to be able to do this for you within the database. This is particular to a facility. It's not something that is generalized. So once that is done, we'll be able to pull this particular information and synchronize the facility with the HIE layer to allow you now to be able to query healthcare worker details, verify your healthcare workers or users in your system, and to also verify clients within your system. It will also help us in upcoming versions to be able to use the claim management part, where we'll just be able to submit the claims management from the EMR, something that is currently under review and work in progress and being piloted. So yes, you need to do that, and you need to consult our service desk team. But before you do that also, we need a non-disclosure agreement form done and signed either by the facility in charge for that facility that wants to integrate with the HIE layer, or the county as a whole for all the facilities that will be using TaifaCare Kenya EMR version, that they agree the users who will be accessing information from the HIE layer, either the client registry or the healthcare worker registry, or even submitting claims, are using the system for the intended purpose. Then these particular users will also be expected to undergo the Data Protection Act training. So through the data protection officers within the county, they can be able to provide this training. The facility itself has certification as a data controller and as a data user. So that covers you in case of anything in terms of improper use of patient information, leakage of patient information. There's something at least the users are consenting not to do, and to do in following the ethical rules of accessing and sharing patient information. So before you contact our help desk team to be able to synchronize the HIE layer for you and do the configurations, we encourage either the facility admin to sign the non-disclosure form. For this particular activity, the partners on the ground are going to assist you to do that. So it is encouraged for a facility to reach out to your IPs for these partners who support you on the ground, or your county teams who will be able to assist you in this particular activity. We had provided a sample of the non-disclosure form that can be edited per facility or per sub-county or per county, and we can still use that one. Then the last question I will sample, we want the very latest one. I acknowledge my colleagues who are also supporting to answer in the chat area. How do we handle this scenario where client ID tells you the ID is registered with another client? Secondly, how does the new version take care of the nutrition module, including reporting? So again, you may want to validate this from the share desk within the facility. Just send them to the share desk so that they can be able to sort this out. Because again, if the client is using or had registered with the ID of another person, then that also brings in some conflict of interest, and you may want them to sort it out first, confirm which is their legal ID, and so on. What you may encounter within the system is having different information pooled when you try to query a patient who you had seen before within the system, where you may find some information differing from what you have in the client registry and what you have in the database. Can be age, can be gender, can even be phone number. Then again, we may also need to send the patient through Afya Yangu. They can be able to edit the information for themselves or send them to the share desk to have this sorted out first so that we can get the correct information, and then we can be able to validate them correctly. Does the new version take care of the nutrition module, including reporting? We will be able to see this in the upcoming training sessions that we have lined up, starting from tomorrow when we're looking at the clinical workflow. So we encourage you to keep on posting your questions on chat. We can also have some questions. Kahawa Level 2 Hospital, your hand is up.
No, Marianne, I think that this is my hand. Like for
The legacy hand, okay.
For Kahawa, I think that is a legacy hand. But I wanted to. I'm sure there are people on YouTube who are also posting on chat, so we'll try as much to also respond to them.
Yes.
When we are done with this.
We will do that. Moses, you also want to respond to some queries, clarify some?
No, I'm okay.
Your hand is up. So again, if we do not fully exhaust the questions here on this chart, you can still be able to access our community of practice that allows you to be able to answer questions. You can get peer-reviewed answers, and you can also be able to see what other people are struggling with, what other people were asking questions to, and what were the responses, and we can be able to learn from each other. So I'm requesting Oguto to also share that link here. Then for the sessions that we have just done, you can also be able to access well-guided SOPs and guides from our resource website. Again, I would request Oguto to just share that if you've not shared. So for every functionality within the EMR system, we have a specific SOP, a stepwise guide to show you how it is done. So I don't know whether we have anybody else on call who would like to voice a question, or we can sample a few from the chat before we close the meeting. From Pauline, does the new module has maternity services? Again, this is a part of the clinical workflow that we'll be looking at tomorrow. Stay tuned. Make sure you log in tomorrow. You can also have your peers who are tasked within the maternity area or the MCH in general to log in, see what is on offer for this particular service within the system, interrogate the system, critique the system, and be able to give us feedback. So we will not preempt this. Allow us to answer this question tomorrow when we are looking at the clinical workflow. Going to see if we have another unanswered question that we can quickly go through. Kindly assist us to know how to insert results in EMR, especially CD4. Again, we'll be able to see this when we go through the lab workflow and also the clinical workflow. Our clinician will be able to access results for the different orders they make, be it a lab order, a radiology order, and so on. So once that order is serviced, how they'll be able to access the result. So I can see that most of the questions have been answered, and we will continue answering them. We will also review the users from the YouTube channel and also address their concerns. We encourage you to log in to the next session tomorrow so that we can also have a continuation of this. Encourage your team members to log in early. And To end the meeting for us, I'm going to hand this over to Moses.
Well, thanks, Marianne. I didn't see this coming, but anyway, yeah, thank you so much for a wonderful session. We are looking forward to be doing this in the next couple of weeks, so that we are able to exhaustively ensure that our users out there are well capacity built to be able to just utilize the system and get value from it without really having to toil so hard. So yeah, we will keep on interacting. We'll try and like I mentioned, we'll try and respond to some of the questions that you posted on chat, especially on YouTube, because we didn't have a team concentrating there. It's just a feed that we relate to YouTube. So I'm sure majority of the questions that were posted on YouTube haven't been answered, but we will. If you are watching us through YouTube, we'll please stick on the comment section. We'll respond to you. Thank you so much. We're looking forward to seeing you tomorrow, and I think I'll hand this over. With having said that, we can probably either call it a day, or Marianne, if there are any other announcements, then we can make them.